So hello guys, welcome to this amazing YouTube channel again, and today we are going to finish just this intro part of general anatomy. So I am a little excited too, and you should also be very excited that अगर तुमने मतलब चारों वीडियोस देख ली जनरल एनाटॉमी की तो मेरे ख्याल से कुछ बचता नहीं है. एंड लेट्स स्टार्ट विदाउट टेकिंग एनी डिले इन टाइम. सो मैंने आज पहले से एक मसल पे बना रखा है. ये स्मूथ मसल है, लाइक यू have read in neat use, like a smooth muscle is a spindle set, so I have made it look like that. So first I am going to talk about the origin. So the end of muscle which is relatively fixed during its contraction, that means when the muscle contract, the end of muscle, that these ends, there will be only one end will that will be in a stationary position, like so the end of muscle which is not moving in the contraction or remain fixed is the origin of the muscle. Like if the this end, if this end we consider here is not moving at the contraction, then it is will be origin. And the other end that is moving during the contraction, it is called the insertion. So always when a muscle contract or not contract, there will be two reason in muscle. One is the origin which is not moving, and one is the insertion which is moving. So the two terms origin and insertion are sometimes interchangeable because these interchange which is with each other during the contraction of the muscle. It depends upon the timing and what type of movement the muscle is causing. So when the origin moves, the insertion is fixed, and when the insertion moves, origin is fixed. So these things are interchangeable to each others. Now the middle portion of the muscle, this is known as the belly. It is fleshy in part, and this is the contractile part of the muscle, because the contractile unit of muscle, as you remember from class 11th or 12th, that it contains the actin and myosin fibers, and how does they move, like from the sliding theory of actin over myosin. So this belly part contains that contractile function of a muscle. Now tendon, what is tendon? The fibrous non-contractile cord-like part of the muscle. So this there is a part here that is non-contractile part of the muscle, and it normally connects the muscle to the bone, and it is known as tendon. It is fibrous in nature. It also comes under specialized connective tissue. It is fibrous and it is non-contractile in nature. Now aponeurosis, the flattened tendon. When the tendon flattens, because of any reason, the tendon flattens, it is known as aponeurosis. Raphe, a fibrous band made up of interdigiting fibers of tendon or aponeurosis. Unlike a ligament, it is stretchable. So what is raphe? Raphe basically means collection of many tendons or aponeurosis which are interdigitating to each other. This is known as raphe. Now ligament, fibrous inelastic band which connect two segment of joints. So basically, if this is joint, so here will be a ligament end, and here will be the ligament end on the two bones, and this ligament is fibrous but non-elastic or inelastic, and this basically joins the bones and control the bone to bone interaction or movement. Now when we are going to describe term used for describing vessels, there are lots of vessels here. You currently know only arteries and veins and capillaries, but now with the further studies, you are going to know more about sinusoids and anastomosis. So let's discuss this. So arteries carry oxygenated blood away from the heart, that already you know. The only exception is this remark that the pulmonary and umbilical artery which carry deoxygenated blood, because mainly we define artery as the vessel which carry blood away from heart. So there are two artery which carry blood away from heart, that is the aorta and the pulmonary artery. Okay, however, this conducts oxygenated blood, and this conduct deoxygenated blood. This is supplying to the body, and this is supplying to the lungs, and then it comes by pulmonary vein to the heart, just like but the blood from the body comes to the heart through vena cava in inferior and exterior. Arteries resemble trees because they have branches. So when arteries branch to give what to arterioles. So it look like tree like structure. Now, what about veins? So veins carries deoxygenated blood toward the heart, opposite of arteries. The exception is the pulmonary and umbilical vein, which carry oxygenated blood. Again, the same principle here. Veins resemble rivers because they have territories or tributaries called venule. Vein have valve to allow union. So basically, a tributary is what? So when many small rivers come and joins to form in the ocean, this joint is known as tributary, and vein works like this. So veins done. Now veins are river like, as I said. So these things, these small rivers which are going to make the joints and then to the ocean like river does, these are known as venules, just like in arteries where they are called as arterioles. So basically arteriole and venules are nothing but a smaller artery or a smaller vein. Now, vena comitans. Vena comitans are two veins, one on each side of a medium-sized artery of a limb joined to each other across the artery. So basically what happens that two veins, like they first understand like this. So here is the artery, got it? Now here is two veins. One vein is going like this, and one on this, both on each side of the big or medium sized artery, normally in the limb, and they join together across the artery, like the across the artery they will join, but the artery will go on. It doesn't joins with the artery, but they join across the artery. So this is known as vena comitans. Got it? Now, what is capillary? Capillary are network of microscopic vessels connecting arterioles to venules. So these arterioles and these venules, small arteries and small venules, yeah, veins. These are connected through what? These are connected through capillaries. Okay. Now, sinusoids. Sinusoids are large irregular vascular spaces which are closely surrounded by the parenchyma of the organ. These are seen in the level. These are the examples. So just remember the example. What is sinusoid? So sinusoid is a large. That means it will be large. It will be irregular in any shape, surrounded by mesenchymal tissue or the outer parenchymal tissue of the organs. And these are vascular spaces, like blood is keep filling in these, and blood is keep carrying away from this by the veins. So this area, this a small type of irregular space is known as the sinusoids. Now, anastomosis is what are pre-capillary and post-capillary communication between the neighboring vessels. So, like, so this is an artery. Let me use another color. So this is an artery, and this is a vein. So, and this is their meeting point. So basically, this meeting point of theirs is known as anastomosis. Like here in picture you can see that this is an estimation where these neighboring artery is actually meeting here. So basically when two vessels gonna to meet and converge into one vessel, it is known as anastomosis. Got it? Now, system of body. So I'm going to only give you a brief of only a short term explanation or a definition of every type. So system of body, there is very various body system in the body, like respiratory system, which is also known as pulmonology. It works it with the all the organs that are involved in the respiration of taking oxygen into the body and giving away the carbon dioxide. Now the articular system or arthology, so it talk about the joints, synovial joints, fibrous joint, and all that. Muscular system, which talk about the muscles normally help in locomotion of the body. Circulatory system or angiology, it comprises all the cardiovascular things like blood vessels, like arteries, capillary, anastomosis, sinusoids, etc. Lymphatic system, which comprises of lymph vessel, all of course, that contain lymph. Difference between lymph and blood is that lymph contain all the component except the blood plasma protein. Skeletal system, osteology, it is said as it deals with the bone, type of bone of the body. Integumentary system, like dermatology, integumentary system refers to the skin system, so it deal with the study of skin related things. Now digestive system, gastroenterology, all things related to the GIT system, yeah, gastrointestinal system of your body. Urinary system, urology, excrete, all thing related to the excretion of various substances from the kidney going to the urinary bladder and ejected through the urethra, so all that comes in this urology part. Reproductive system, divided into andrology for males and gynecology in females, so deals with the male reproductive and female reproductive system. Embryology, how does the fetus is going to work. Delivery. Endocrine system deal with the hormones. Endocrinology, it is said as, so it deals with the hormones, glands, exocrine and endocrines. Now special senses are what? So there are special senses we human got, like a sense of taste, sight, smell, hearing, balance and touch. So these are the senses. Now nervous system or neurology deals with the neurons, brain, spinal cord, autonomic nervous system, somatic nervous system, peripheral nervous system, and that's all. Now there is this table given in Bidicharus here, named as term used for describing bone feature. Let me zoom this. It is less clear, however. So when we see bone, then we see different structure on bone. That is the structure this table is talking about. So we can see a line. Example is your superior knuckle line and so inferior knuckle line on the occipital bone. That is the back of the skull. Crest. Crest is the iliac crest. It's like a mountain type of structure. Now ridge, so example is medial and lateral supercondyle region. These all you are going to just see in detail in the further part of anatomy. So just remember these names for now. As you will progress with the volume 1, volume 2 and volume 3 of BD Chaurasia, you will get everything in your mind. Now there are some rounded elevation like tubercle, protuberance, tuberosity, malleolus, and trochanter. All are the examples given. Sharp elevations are there like a spinous process, styloidal process. Examples are there. Expanded end of our articulation like head of humerus, head of femur, condyle, medial and lateral condyle of femur, epicondyle, medial and lateral epicondyle of femur. A small flat area for articulation like facet on head of rib for articulation with vertebra. Depression is like notch, greater sciatic notch, grooves, bicipital groove of humerus, fossa like radial and coronoid fossa, openings like fissures, superior orbital and inferior orbital fissures, foramen, intraorbital foramen, canal like carotid canal of temporal bone, and meters like external accessory meters and internal accessory. So if you are not able to understand these things for now, let's just hold it, because part wise you are going to understand everything in the osteology part in the respective books. Like when you start studying upper limb, then the first chapter you are going to study is the osteology, where every example is going to be discussed in very high class manner. So you will understand there only. Like there is a figure, so this is superior knuckle line, and this there will be an inferior knuckle line also. This is one. So the, as you can see, this is the spinous process, this is the crest mountain, like I said. Like, so as you can see that these are the things you are going to get all these in further part. So thank you for today's guys, and I hope that this video is also hopeful. And if you have noticed, you have seen that there is an histology part here. So I have also prepared histology for slides for you. So maybe the next video I'm going to upload is of histology, epithelia mainly. So this is quite a update for you. So subscribe to the channel and just be on the channel, because the videos are going to be constantly uploaded now, and if you miss them then it will be very bad. And the counseling is also going to start, so there is not much time in starting the college, so you should study, you should start studying. So thank you guys. Please subscribe the channel, like the button, and of course press the bell icon so you get the latest update about the lectures. Okay guys, goodbye.